Good afternoon. County Executive Rich Fitzgerald here to give our weekly update on the COVID-19 pandemic, here with Dr. Deborah Bogan from the Allegheny County Health Department. We continue to see better numbers, and Dr. Bogan will certainly go into that. Better numbers on cases, percent positivity, hospitalization, severity, and fatalities after having come through some very, very difficult months of December and early January. Starting in the second half of January and the first couple of days of February, people have been much better about wearing masks, social distancing, all the things we know are effective in preventing the spread. And obviously more and more people are becoming vaccinated, at least with the first shot, and so many with the second as well. And that will certainly help, particularly in our long-term care facilities who have proven to be the most vulnerable throughout the pandemic. You're going to hear from Dr. Bogan. You heard from Dr. Fauci maybe earlier today. We have Super Bowl weekend coming up. We know that's, again, a time when people often get together. Not as much this year with our beloved Steelers not being in it. But we know people have had Super Bowl parties. And we know going back again to late October, November, December, when people get together for traditional times. We ask people, again, use good common sense, social distancing, wear your mask, avoid Super Bowl parties, those type of things. One of the things we're seeing out of the federal government, you're gonna hear some of that again from Dr. Bogan. We know that there's going to be more distribution, was announced yesterday, to local pharmacies throughout the country. We just don't know yet. We don't have a lot of that data. We know that they've talked about increasing by a certain percentage, 15 to 20%. Distribution going out. Again, we don't have exact numbers on that. We're working on that with our friends at the state to see where that goes. There's some preliminary info, coming out about the efficacy of the other non-approved yet, Moderna and Pfizer being the only two that are approved. But good information that's preliminarily coming out about Johnson & Johnson and AstraZeneca, et cetera. So that's all good news. Hopefully that'll get moving very quickly. Two things I think we were ahead of the curve on here in Allegheny County. President Biden instituted, when he got into office, a mask mandate at all of the federal buildings. And now he's extended that to airlines, transportation, public transit, et cetera. We were already doing that. So I feel like for our county buildings, we had issued that executive order. Our airport, our Port Authority, et cetera, we were already on board on that. The other thing that changed with changing in administration was President Biden indicated that he wanted to make sure we had a sign language interpreter at all the press briefings in the White House. Again, you see Danielle every week. We've been doing the same thing because as the president wants to make everybody's inclusive, that we're inclusive and everybody can participate. That's exactly what we've been trying to do as well. So we appreciate the fact that we were on the right track on that early on. So again, thank you all for your patience, and let me turn over the weekly report to Dr. Bogan. Dr. Bogan?
Good afternoon, and thank you for joining us again this week. Quickly about our numbers. They continue to head in a positive direction. Our county is averaging about 240 cases a day, which is a drop of about 50 cases a day compared to last week. And our positivity rate is also down nearly 1% and is at 6.8% currently. As I mentioned last week, I am encouraged by these numbers, but I still remain concerned about future surges. So please be cautious this Super Bowl weekend. Even though the Steelers aren't playing, I know many of you plan to watch the Super Bowl, and I encourage you to stay safe while doing so. The safest Super Bowl parties are ones with only members of your household. Gatherings with others outside around a television where they'll be cheering, eating, drinking, puts people at risk for spreading or catching the virus. So please stay home and enjoy the game. Now on to vaccines. The supply of vaccines continues to be the limiting factor to an expanded rollout in Allegheny County. I'm hopeful that will change soon. There have been a few announcements about more vaccines coming to states, and I'm confident that we will start to see those allocations increase in Allegheny County as well. Also on the horizon is the possible approval of a third vaccine for emergency use by the FDA. I will be thrilled if the Johnson & Johnson vaccine is approved. It's a one-dose vaccine, which means it's much easier to administer. And the Johnson & Johnson vaccine also appears to be quite effective. The vaccine was 85% effective at preventing severe illness and 100% effective against COVID-related hospitalizations or deaths during the trial. And that really is our goal in this pandemic. We should be focused on preventing people from becoming seriously ill, from being hospitalized, and from dying from COVID. This idea of vaccine preventing serious illness and hospitalizations or death isn't new. This is how most vaccines really work. For example, the flu vaccine does not prevent 100% or even 95% of infections, but it does greatly decrease a person's risk of developing serious illness from the flu. So according to the CDC, the flu vaccine reduces the risk of being hospitalized or being admitted to an ICU from flu by about 40 and 82% respectively. The health department is currently working on expanding its vaccine rollout, but we continue to look at possible sites around the county for additional vaccination clinics. We really want to spread clinics out for ease of access. And as we set up these locations, we will certainly let you know how to make an appointment. However, the health department can't move forward with more clinics until we have more predictability of how much vaccine we are getting. For instance, the health department currently has 14,000 vaccines allocated for appointments over the next 2 weeks. Our vaccine shipment from the state this week, however, was only 1,000 doses. That will cover the second doses for the health department has to give out, but it doesn't really allow us to expand our currently planned pods. And the state has assured us and all of us around the state that we will have enough vaccine to cover second doses. So if you received your first dose from the health department, we will be able to provide you your second. You should get an email about 10 days before your second dose appointment with directions on how to register. I know that people are very frustrated that the health department is only vaccinating those 65 and older, even though the state's vaccine plan put people under 65 with certain health conditions into phase 1A. The state does allow individual vaccine providers to prioritize within phase 1A, and the health department has decided to prioritize those 65 and older. The single most clear determinant for whether a person will develop a severe case of COVID-19, be hospitalized due to COVID-19, or die of COVID-19 is age. And the older someone is, the higher the risk. In Allegheny County, over 90% of those of deaths and 65% of hospitalizations have been among people 65 and older. As we vaccinate more of those 65 and older and more vaccine becomes available to the health department, we will expand to reach the full 1A groups. So finally, just a few reminders. The health department is not offering COVID vaccines at its immunization clinic. So please do not call the clinic looking for COVID vaccines. With cold temperatures forecast for next week, the health department will be limiting COVID testing at the McKeesport site and at its mobile sites from 11 a.m. to 4 p.m. And appointments will only be available next week during those times. Next, even though many health department services will be closed for the President's Day, the McKeesport testing site, our curative testing vans, and the Monroeville Vaccine Clinic will remain open. And finally, thank you. Please stay safe and be kind.
Our first question is from WPXI. The Pennsylvania Department of Health reported this morning that it will receive 9,000 additional first doses of the vaccine next week from the federal government. Is the county expecting a similar bump in supply?
I don't know. We'll have to wait and see. But this does highlight sort of our challenges. We can't plan for the future when we don't know how much we're getting. So I don't know yet.
This next question is from KDKA. You referenced the difficulty in making sure that people are vaccinated. Can you tell us when everyone in phase 1A will be able to get the vaccine at county pod sites?
I sort of really addressed that. We don't yet have that information. We'll keep you posted as we change our criteria, but it's certainly not in the next couple of weeks. We still have lots of 65 and older to reach in our county.
I hope you have your gazing ball with you to. His next question is from the Post-Gazette. Pennsylvania Department of Health data shows Allegheny County is seeing roughly a few thousand vaccinations on an average day since mid-January. With so many more people now eligible and nearly 2 million total vaccine doses distributed in the state, when do you think we can expect to regularly surpass 5,000 or 6,000 vaccinations a day in the county?
We would love to do more, and it really depends on supply. So we are putting in arms the vaccine that is coming to the county. As more vaccine comes up, we'll see a larger number of people. I also want to just caution that what appears on the state's website by county of numbers of people vaccinated doesn't reflect where people got their vaccine. It reflects where their home of residence is. So if we vaccinate someone who works in one of our hospitals in Allegheny County but lives in Westmoreland or one of the other counties, it's counted at that county's residence. So how many we've given in the county versus how many show on the website may be a little disparate.
This next question is from Public Source. How large is the racial gap in vaccines right now? Have there been efforts to prioritize the administration of vaccines in areas where Black residents live, such as creating new vaccine distribution centers in those areas?
That's a great question, and I ask you to ask that of the state because they have those data. We've requested that data so we can really target communities, but we haven't gotten that data yet.
This next question is from the Tribune Review. Data on the county site shows a decrease in PCR tests. Does this mean that fewer people are seeking tests, and is this at all concerning to you?
So we have definitely seen a decrease in testing over the last couple of weeks. And interestingly, if you look back historically, our test numbers really parallel the numbers of cases we have. As cases start to rise, testing numbers increase. As cases go down, our testing numbers decrease. I do want to tell you that we have lots of capacity for testing. That hasn't gone down. So that I don't think is the issue. It really, I think, has to do reflecting of people's desire to be tested. But I encourage, again, anyone with symptoms, anybody who thinks they were close contact, anybody who is a household contact of a case should get tested, and that availability is there.
This next question is from WTAE, and I believe you did touch on it briefly. Pennsylvania ranks 38th in people who have gotten their first dose, according to the CDC. We know volume is an issue, but in your mind, is there other logistical holdups that could be fixed or improved to get more vaccines into arms?
Yeah, I really think that more advanced warning of what we're getting will help all of us plan more effectively and efficiently. And the state is aware and I know is working on this. I also think we need improvements in our registration system, which has been a challenge, and we continue to work with the state and locally on issues of registration.
To that point, the next question is from USA Today. Could you explain the state's role in the scheduling or registration system? In the Department of Health presser earlier today, the state said it isn't involved in scheduling, but there's also been a lot said about how the emails for those who are scheduling appointments through the county health department are through a state system. So just looking for some clarification on how they work.
Sure. The state did purchase a program called PrepMod that was allowed, we as county health departments were allowed access to use that, and we have been using it. We use that software to set up our local clinics, so we have control of setting up the clinic numbers, where they're going to be, but the software was purchased by the state. So I think that's probably the discrepancy, is that we use the software purchased by the state. We have been working with the state on making some improvements to that software.
This next question is from WTAE. Earlier today, the county health department issued a press release reminding providers of fish fries to make sure that they're getting their temporary permits. Can you talk a little bit about how fish fries may will look different this year?
Well, fish fries are food service, and they fall under the guidance from the state on food service criteria. So I would guess that there's going to be a lot more takeout this year. And again, I've been to a couple fish fries that can be pretty crowded events. So this year, I hope they're not crowded events, that they are spaced out, that they meet all of the occupancy requirements that the state has laid out during COVID. So wider apart tables, sitting only with your household, and again, lots and lots of takeout.
This next question is from the Pittsburgh Business Times. Has Allegheny County or any of the providers of vaccines that you're aware of seen a decline in the number of vaccines delivered over the past week or so? And if so, what has led to that? Has it led to appointments being canceled?
So I just remind everyone that the distribution of vaccines is posted every week on the State Department of Health website. So you can see exactly where vaccines have gone week by week. I can't tell you exactly who's gotten less 1 week or more. I can just talk about what our Allegheny County Health Department has gotten. And we have definitely seen variation in what we get week to week. And that has to do with the distribution of how they're sending vaccines out. We have not had to cancel appointments for anybody for whom we've made an appointment because we've allocated our doses planning, like I said earlier, so we make sure anybody who has an appointment has a dose allocated to them.
This next question is from WPXI. Can you tell us where the county stands when it comes to vaccinating healthcare workers? Given current supply, do you think that that process is expected to take a longer time, or do you have any idea where we might stand right now?
For sure, there are some healthcare workers who have not been vaccinated yet, but I can't tell you exactly who they are at this point. Or exactly how many, and I hope that they are getting registered at our site and others to get their vaccines. But again, the healthcare workforce in Allegheny County is quite large. That's all I know about that.
This next question is from Katie K.A. Do you have any information on where most people are going to get their vaccine? Are they going to an urban area or the suburbs, rural locations? Is there any data that the health department has on that?
Again, that's a great question. That would be data that the State Department of Health has at this point. But my experience is that people are going everywhere and anywhere there's a vaccine, people are going. And they are searching out vaccines. So that's good. We want people to get vaccinated. But I don't know exactly the data to share with you.
I have two similar questions from the Post-Gazette and the Pittsburgh Business Times that I'm going to combine. Have we seen any evidence of any of the variants here in Allegheny County, whether it be from the UK, South Africa, or Brazil? And could you also talk a little bit about the health department's potential response plan if we find that variant in Allegheny County or surrounding counties?
Yeah, so to the best of my knowledge, we have not seen the variants here yet, but we really need to prevent the spread before we detect it. Right, we're not sending every test we send to see if it's a variant. So we just have to work to prevent the spread. And we know how to prevent the spread of COVID-19. And whether it's a variant or not, we just have to be vigilant about doing that. So we shouldn't wait till the variant is here to start those activities. We really need to be vigilant and prevent that. So that is wearing masks, and a properly fitted mask is essential. One that fits snugly over the bridge of your nose, comes down below your chin, is tight, and doesn't let the air leak out. Really, that your breath needs to stay within the mask, so as much as you can. So properly fitting masks, washing your hands, staying out of crowded places, keeping at least 6 feet apart, farther inside, keeping good ventilation, all those things reduce the spread of the virus, whether it's the variant or not. So we need to prevent it and not wait till it's here to be active in response.
This next question is from WTAE. Do you have a position on some of the recent studies showing vaccines may still be effective if you lengthen the time period between the prime shot and the second booster in the series? And do you think that should impact distribution or the need to hold back doses at all?
Yeah, I think at this point we don't have the data to support a change in vaccination scheduling. The CDC has continued to stand behind following the guidance of how the vaccines were studied. There is ongoing surveillance and studies. If the data become available that is the way to go, then we might change it. But for now, I think we all need to stay steady on using the vaccine the way it was studied and intended, and not make those changes at this time until we have clear data that support that change.
And this final question, also from WTAE, the Biden administration announced yesterday 6,500 pharmacies in the country will be getting additional vaccines starting next week. Do you know how many of those may be in Allegheny County?
I do not have that data, but again, the state posts every week on the website the pharmacies in our community that are getting vaccine, And I noticed last week that a number of Giant Eagle pharmacies and a number of Rite Aid pharmacies did get small numbers of doses delivered to them last week and this week, I believe. So again, I don't have the exact numbers from that program from the federal government, but there are pharmacies on the map that have definitely been getting vaccines across our county. And there are small pharmacies and big pharmacies, but they're all getting so small numbers of doses to deliver in their neighborhoods.
And that was the final question. If there are any closing remarks.
Thank you, Dr. Bogan. That certainly covered an awful lot of information, a lot of areas of questioning. And again, the good news is that the folks in Allegheny County have continued to wear their masks. The numbers keep coming down, which is a very, very good positive sign. Again, after some tough times, about a couple month period. And as our college students have come back for the spring semester, we're also getting good reports there that low positivity rates among that group, which again, thank you for great levels of cooperation. We continue to hear that whether it's businesses, whether it's construction sites, whether it's schools, that the official operations are very, very well, and people are staying very vigilant in wearing their masks, social distancing, all the good things that we need to do. And it's that level of cooperation that's really going to make us continue to get through this until the vaccines really start to get in to more of the population will be vaccinated. Also want to thank so many people who have contacted us offering their services, offering their sites, pods, volunteers to put shots in arms, all these type of things. It really comes down to us getting more of the product. More vaccine is really what we're going to need to happen. And I guess the last thing I'll talk about is the fish fries. I would hope, it's one of my favorite things to do, but we're going to do it differently this year. We would hope people would still continue to support your parishes and your organizations who do the fish fries. Do it by takeout, as we've indicated, our friends in the restaurant business. Continue to patronize your favorite restaurants and the favorite places you enjoy dining, but just do it differently. Do it with takeout so that you still enjoy the great food, but helps keep people in business and keep people working. So hang in there. We're continuing to do everything we can to get more vaccine into Allegheny County. We'll continue to work with our friends at the state. Good to hear some of the things coming out of the federal government, and we'll follow up to see where those numbers go and try and get as much information out as we can. So everybody